Good evening. Welcome to Harnessing Abilities. We are going to talk about healthcare transition with Bridging the Gap tonight.
Woohoo!
Give me 1 second. I'm going to go ahead and start to share my screen. We got a little PowerPoint to go through tonight.
Not the right screen.
That's the right screen.
That's the paperwork to make sure everybody's here.
Oh, well, let me try this screen.
Yeah, try the one with the actual PowerPoint and not the Excel sheet. Because I'm pretty certain people don't want to see an Excel sheet.
That may be person identifiable health information too.
More, that's just their emails and names.
And so we don't want that. That's true.
No, we don't want that. We really don't want that.
All right.
And
there we go. Everybody okay? Fantastic.
Awesome. Thank you, Rose.
So this is what we're going to be talking about tonight. We're going to be talking about bridging the gap, moving from a transition from pediatric care to adult health care. Are you an adult or are you an adolescent?
That is a loaded question. I hope you understand that.
Are you grown up yet?
What do you think?
No, I'm not grown up yet.
No.
So I don't.
When are we truly grown up?
I don't expect you to be grown up yet either.
No.
So my name's Tim Markle. I am Hunter's dad. I also work with the Youth Health Transition Initiative of Wisconsin, and I direct the Southern Regional Center for Children and Youth with Special Health Care Needs. We cover 14 counties in Southern and Southwest Wisconsin, including the awesome county of Grant, the cool county of Crawford, and all sorts of 12 others besides that. Please don't ask me to name them on a Wednesday night. But we are excited to be here. You want to tell a little bit about yourself?
I thought it was 13 for your center.
No, I got 14 counties.
Oh, I keep forgetting about one then. I don't know which one I keep forgetting, and I'm sorry for that. But my name's Hunter. I'm this amazing man's son. Well, the man who holds so many titles that it won't fit on a simple piece of paper.
It doesn't. I have a trifold like business card that I carry around.
He has a scroll.
Yes, there you go.
He carries a scroll.
I wish I had a scroll. That'd be cool.
We should try and figure out if we could allocate a personal budget for that.
Let's go back.
Yeah, let's get back on track.
Okay.
Let's stop the train on that.
Anything else you want to tell about yourself?
Not at this point.
Okay. Do you have any sort of expertise in transitioning or special healthcare needs?
Yes, but that is for later on.
Oh, okay.
When we get to those parts.
I trust you to get there.
Yes.
So we are part of the Wisconsin Title V Children and Youth with Special Healthcare Needs program. We have a number of partners that we work with throughout Wisconsin. Because I am personally biased, I think the most important people that we need to remember is that you have 5 regional centers throughout Wisconsin. So no matter where you are joining us tonight from, you have a regional center that is there to help connect you to your local resources. They are there to offer trainings. They are there to support you as you go through this journey of having a child with special health care needs. And they're there to help you as your child grows up through adolescence and becomes an adult up to age 21.
I think I keep forgetting about Adams County.
Oh, I love Adams County.
I know. I just keep forgetting that that's part of your area. That's what I mean.
It is. Yeah, no, they're right there.
Yeah,
they're awesome.
Yeah.
They're awesome.
I know. I just forget that they're part of your regional center.
So feel free. We will be putting together a resource sheet after this, and on there will be a link to find your regional center if you are not in the Southern Regional Center, because of course all are welcome. We are glad that you are here. So tonight we are representing not just the Southern Regional Center, but also Health Transition Wisconsin, supporting youth to be successful in adult healthcare, not just get there to adulthood, but to be successful in taking charge of their own adult care. And as I said, we're named Youth Health Transition Initiative, which of course I like to call Yeti.
That's the abominable snowman. I will continue to remind him of that fact.
I think it's a Yeti.
We can call it a Yeti as long as we want.
Okay, so I'm going to call it, it's okay if I call it a Yeti?
Yes.
Okay, I'm calling it a Yeti then.
Please try and keep count. There's no prize, it's just fun.
Right, because we keep changing the PowerPoint.
He keeps changing the PowerPoint.
And so we have no idea how many Yetis have made it into the latest one. So we're just not sure. But the Youth Health Transition Initiative, we are here to help ensure that high quality, developmentally appropriate healthcare services are available in an uninterrupted manner as a person moves from adolescence to adulthood. Those are a lot of words. Basically, let me try to explain healthcare transition like this, okay? You have an adolescent and a child, and they're leading up to becoming an adult, because we want all of our children to grow up to be adults. And so on this on-ramp, this is where they're learning how to maybe manage their own medications. They're learning about what it means to talk to their doctor and to talk alone to their doctor. So there's this onboarding. So they get used to the healthcare system. And then we have what's called this transfer of care, where they actually move their care from a possible pediatrician, or they may already be seeing a family doctor, but they move from the pediatric adolescent child system into the adult system. And there's an actual transfer into a new system. Now, it may look seamless, but it's not. There are changes in that adult system that you need to be aware of. Appointments get set up differently. Appointments are handled differently. People are sometimes different, but that's not the end of transition. The transfer of care is not the end of transition, because then we want to make sure there's an off-ramp. We want to make sure that our young adults are successfully part of the adult healthcare system so that they can receive continual care. Why is continual care so important for some of our friends and families?
Because it could lead to better health.
Definitely leads to better health. Definitely leads to, there's some people who they see a lot of doctors.
Yep.
And they need to see doctors pretty continually so that they can stay on top of their healthcare needs.
Yep.
And
Thank
so
goodness I'm not one of them, but yep.
You are not, and neither am I. We're very, very fortunate that way.
Yep.
But there's some people who, they just really need to stay more on top of their health than we do.
Yep.
And so they need that on-ramp, a good transfer of care, and then they need to learn to be a part of that adult care. So when we talk health transition, we're talking all three parts of that bridge, so to speak. So we want to talk about how transition starts in early adolescence. How old do you think you should have someone? How old? Because I was not great with you, as I started a little later than I should have on health transition.
We also should have talked to my pediatrician about it earlier as well.
That is very true. But when do you think would be a good time to start talking about healthcare transition with students?
Early teenage, like 13, maybe 14, to get the ball rolling on them to search it out for themselves and to talk with their parents.
I think there's a lot you could do at that 12 and 13 years old. That's part of that on-ramp.
I don't think 12
You're absolutely right. 12, 13. We'll go 13.
Yeah, let's go. Okay. Let's just go for that.
How
13.
about this? You go 13, I'll go 12.
Deal.
Okay, good. And then that transfer of care happens sometime, hopefully between the ages of 18 and 22. We do know that there are cases where we have some children with special healthcare needs that there's not really an adult equivalent yet for that specialist. And so they may be remaining in this transfer of care portal for a while longer besides 22. But we need to remember,
really needs to fix that.
we need to make it a lot easier. But what we need to remember is that the doctors over here are used to dealing with kids and adolescents.
Yep.
They don't necessarily understand older adults, middle adults, adulthood.
Well, some of them might. It's just the fact that they're more used to seeing younger kids and everything, that part of their care hasn't really fully come back yet.
Yeah, that's true. And there's some doctors who see all ages.
Right.
So we need to make sure that we have the right doctor seeing the right patient.
Yep. Can we please move on from this slide before they start getting glassy-eyed?
Oh, good point. Thank you. Yeah, there's not even a Yeti on that slide.
It's not even a Yeti on that slide.
Oh my gosh, remind me to add in a Yeti.
I'll remind you to add Yetis every 5 slides. How does that sound?
So that would be wonderfully annoying. Please don't. So the youth health transition, what we are doing, we are going to support healthcare providers and organizations as they work on transitioning their patients through their system. We have a learning community, which everybody is invited to join. We have an awesome website that we will share with you later tonight. We do outreach in the community, trying to partner with the schools, trying to partner with DDR, trying to partner with anybody else who is involved in transition to get healthcare to be part of that transition conversation. And so we are constantly trying to get good resources into the hands of our partners, into educators' hands, into employers' hands, anybody who will listen to us. So we've already kind of talked
Does
about
that include the
what
homeless
is.
community?
Yes, we worked with a organization in Madison, and I cannot remember their name, but yes, we talked to families because families who are homeless might also have children with special health care needs. And so we want to make sure those families also know about the resources. So
Woohoo.
absolutely.
Good.
Way to think about them.
You're welcome.
All right, we're going to talk a little bit about readiness. We're going to talk about an assessment. We're going to cover 8 tools for healthcare transition. And then we're going to just talk about different ways that we can help youth to own their own health and to advocate for their own health. But first, I'm tired of talking.
Yay.
I want you to talk.
All right. First off, the Yeti was not there when we took this picture. That was photoshopped in later on.
And a really poor Photoshop job.
Very poor Photoshop
That's
job.
really poor Photoshop.
But we are up in Door County for, I believe, my grandparents on my mother's side's 50th.
Mhm.
That was their 50th, right?
Wedding anniversary?
Yeah.
I think so.
Yeah, because, yeah, that makes sense because we were down in Texas and saw a couple that had 60 years.
That was amazing.
That-
They were an amazing couple, still dancing.
Yep.
So what were we doing? What were we doing in that picture?
Well, beyond standing on a rock that has now been subsequently submerged into that
Yes.
gorgeous lake,
It's underwater.
it basically was you, Mom, Sammy, and a couple cousins to get me out onto that rock.
So you didn't want to go out on that rock initially?
No, I did not. It was
Hmm.
kind of like the St. Louis Arch trip. I did not want to ride in those elevators.
But you did the St. Louis Arch trip,
I did.
and somehow you got out onto that rock.
I did.
So how did you go from not wanting to go on the rock to standing on the rock and getting your picture taken?
Through your guys's pushing, carrying, and making sure that the rocks were stable and not wet.
Yeah, so we walked out there ourselves to show you
Yep.
that it was wet. We took our time, walked around the building
Yep.
a few times, get you
Very
used.
nice building as well.
It was, get you used to the area. And so we did a lot of preparation so that you could make that next step.
I think the only 2 things out of that set of clothes you're wearing that you still don't have is the belt and the shoes. I think you lost both of those. I don't think you have the belt and those shoes anymore, but I know you still have the shorts. I know you still have those socks, and I definitely know you still have that t-shirt.
Is this really important to healthcare transition, Hunter?
No, I just felt like pointing it out to keep people entertained.
All right, then. So let's get back to healthcare transition.
Yay.
So the point of that story,
Stepping stones.
stepping stones to get to your goal,
Yep.
is that nobody is going to understand how to take care of their own health, understand the healthcare system, understand health insurance all at once.
Correct. That is one bag of monkeys we will never fully understand.
Bag of monkeys.
Yes.
Pretty sure that's a mixed metaphor that I love. So yes, we're going to talk about stepping stones to be able to successfully transfer care.
I don't even know what metaphor I was going
I don't.
for.
I bag of cats, a barrel of monkeys. I don't know.
No,
I don't know. I don't know where you're going, but I'm glad that you're here.
Same
So
here.
healthcare transition, again, if you haven't understood it yet, we're talking about the process of changing into the adult model of healthcare.
Hey, got transition. Woohoo.
Yeah, you like God
I like
transition,
got
right? Yeah,
transition. Their Readiness
so we're
assessment is
not-
awesome.
yeah, we're not doing this alone. We have a
No,
national partner in God Transition who is
Wait, they're
all about,
national?
oh yeah, they're all about, you've worked with them. They're all
I've
about
only seen their
helping.
Readiness
they're-
assessment.
Yeah, they're
Not
out
many
in-
one from got
No,
transition.
that's because they're out in Washington, DC.
Oh, that explains it.
Yeah. And not many people are traveling for the last 2 years.
We've traveled for
But
the
we're not
last
going to
2
talk
years.
about that, are we? So we do have national partners in GOT transition. So Hunter, who needs to think about this transition thing?
Everyone, but especially
much.
teenagers, young adults, their families, healthcare providers, schools, politicians. As much as I dislike them, they really do need to focus on this as well to help us out.
Could use a little help in a couple of legislator things to help make this a little easier, huh?
Oh yeah,
That's called advocacy.
yes.
We'll work on that at another time.
Yes, that is a different PowerPoint.
And again, some of you may be listening and you're like, what was the big deal? I grew up just fine and nobody helped me transition to healthcare. Well,
Different times.
Yes, I would say that it's a lot more complicated these days than
A
it
lot
used
more
to be.
complicated.
And then a lot more complicated.
Yes.
And then
definitely.
we know that if a youth has a disability or special healthcare need, that's added on top of regular medical care. And so these things keep piling up. And so if we can prepare,
and it sucks,
the better off we are. It does. It really does sometimes. Why is health so important?
Well, increased independence, success in day-to-day life, opportunity to go to college, universities, technical colleges, secondary educations, or just straight up into the workforce if you want to make that money.
I'm surprised you didn't do this.
I wanted to, but that felt
yeah.
too much like Michael Corleone.
Very good. And what, for you, how does you having good health make you more independent, make you more successful? What's that connection?
I'm not a good example because I'm lazy.
You're not lazy. You just have some motivation challenges. How's that? Does that sound better?
No, that sounds worse.
But you are relatively independent, Hunter.
True.
You are very independent, actually.
Yeah.
So think about everything that you can do and how that would be impacted if you weren't healthy.
Wow, that's a callback.
So how does health help you be independent? What are the things that you get to do because you understand how to take care of yourself?
Well, outside of having these fun talks with you and the very nice people out there and everything listening in, hello, by the way, it helps by searching for a job, by having health. Being healthy can help with that. Make sure that I can go out, have fun with a few friends and acquaintances from church, game store, from any walk in life, pretty much.
Yeah, all those things you couldn't do if you weren't healthy, if you didn't take care of your health.
Yep.
So it impacts your independence. It impacts your success.
Yep.
When you are going to Madison College.
Madison Technical College.
You had to be healthy enough to go to classes and do your homework.
Yep, which was very fun because it was on the onset of COVID.
Yeah, that didn't work out very well, did it?
No, it did not.
And then working, you learned firsthand how important understanding about your health is and talking about your health.
Yes, it's very important.
Do you want to talk about that now or later?
Let's talk about that now.
All right. So tell me your working story and how health came into when you were in the workforce.
One of my first jobs was here at a rehabilitation home that will not be named because of an NDA and everything. Even though I'm not working there anymore, I will continue to not really talk about who I met there.
Good for you.
And the business name outside of interviews and everything. So zip on that.
Good for you.
I had a health concern with my lungs due to a industrial dishwasher in my job capacity as a dietitian's aide.
So you started as a dietitian's aide.
Yes.
And you were in the kitchen helping to get food for the residents, and you're also responsible for the dishes.
Correct. Yes.
Which is very important to get those clean.
Very important to get those clean because a lot of them are on the older side of health.
Sure. And so
some of them are older than you and they can walk around better.
Thank you for that.
You're welcome.
So let's get back to your story about your lungs.
So my supervisor noticed that I had to start carrying around an inhaler because it was getting hard for me to breathe. I never had asthma. I never carried an inhaler for any point in my life. So this was something new to me. And my supervisor went up and asked me, do you want to continue working here, but move over to the housekeeping department? And I jumped on that opportunity and joined the housekeeping department. I continued working there for another year and a half, 2 years in total while there. And it was fun in housekeeping department. Granted, I went through 5 different supervisors, which is kind of like shuffling a deck of cards, but the house never wins if you were in Vegas.
There you go.
Because every supervisor was different.
True.
All really good supervisors, though.
And so all during that is you were having doctor's appointments, trying to
Yep.
figure out what was going on with your lungs. You're trying to balance work.
Yep.
And you ended up being able to have that conversation with your supervisor.
Yep. Very nice supervisor, really cared about their workers.
That was a good job advocating for your own health.
Yeah, and it also paid okay too.
All right, time for a quiz.
Yay, quiz time.
All right, so in America in general, what transition occurs at age 16?
Driving, if you can get on to the next slide. Yeah, let me try something.
I got
There
it.
we go. Yep, the ability to drive at age 16, which
Okay.
did not work out for me because
There
it
you
took
go.
me 3 tries.
Why did it take, well, yeah, 3 tries, but it also, you didn't really want to drive right away.
No, I still, well, no, I really love
And
driving.
I know you really love driving, but do you remember when you were practicing driving, what it was that you told me about getting your license? Because we had to renew your temps,
Yep,
which was fine.
yep.
But you said, I want to be really careful because there's a lot going on when you're driving.
Yep.
And you're absolutely correct. So I love the fact that you waited until you were comfortable
Mhm.
to be able to get your license. You didn't stop. You didn't give up. You
No.
kept learning.
Yep.
You kept trying.
Yep.
That was a great job. Okay, age 18.
The ability to vote and becoming an adult.
The ability to vote, which is really important.
Yes, always vote.
And becoming
An adult.
Did you look forward to becoming an adult?
Has anyone looked forward to becoming an adult?
Yeah, there's probably some people out there who have, but yeah, it's kind of scary.
They might be slim to none.
It's kind of scary when you think about
Not
trying
as
to
scary
become an
as
adult.
this one, because this one can destroy your liver.
Okay, so age 21,
Drinking responsibly and
That's
also
right.
smoking responsibly.
there you go. Which,
We honestly need to put that in there as well.
well, I see the thing. We can talk about that later.
Yeah, because that gives you lung cancer.
Yeah, it's very bad for you.
Yeah, that one's
And
sometimes
drinking,
worse than
you
drinking.
need to drink responsibly.
Yeah,
And you've learned that too.
yeah.
Okay, but overall, when we talk about all these things, what we're talking about is being an adult. We
And
know it's
adulthood.
going to happen. We're going to become adults.
Yep.
We may not act like adults, but we're
Nope.
going to become legally responsible for our decisions.
Yep.
All right, so that's becoming an adult. And so what we want to do is we want to try to,
Stay a step ahead with that nice, lovely Yeti.
all right, so let's talk about what we can do to stay a step ahead. You already talked about
The
health
readiness.
transitions readiness assessment.
Yep.
So what do you know about the readiness assessment?
I know that it's amazing. I also know that it's in Spanish for those who do have Spanish speaking
true.
friends, family, coworkers, or students.
Mhm. What's it used for?
Health transition and figuring out where in the healthcare system you would fit best.
Yeah, that could be part of it.
I
Absolutely.
don't know the full story behind it, so you can't explain because that's all I know about it. Beyond it looks fun
It is fun. And it's a
and
way,
helpful.
very much so, because it's a way to, so it has all sorts of different categories about this is something I want that I do well. This is something I want to learn how to do, or this is something I'm never going to be able to do. This is just not something I'm going to do.
Right.
And so then you can take the assessment to find out what are you already good at. There are a number of things with healthcare that you're already good at.
Yeah.
You knew how to get sleep.
Yep.
I'm sure there was more.
There is more, but we will talk about that later on when we get to those slides.
So it's good to know what you're good at,
Yep.
but it's also good to know what you need to work on.
Mhm.
And so then the readiness assessment is a way to see what you're good at and find out what you can work on. And you can have this discussion about who's going to help me with it.
Yep.
Are my parents going to help me with it? Is my doctor going to help me with it? Is my nurse going to help me with it? Is there a specialist that's going to help me with it? Is my school going to help me with it? Who's going to help me learn?
Yeah.
And so there's all these different people that could help, but you got to know the area to help them.
Anyway, I think
Are
the
you
phone's
waiting
going
to?
off.
are
Yes,
you
I'm
waiting
going to
click
show
that?
them an
Okay.
example of it.
So God Transition has a number of different transition readiness assessments. They just came out with a new one that they're piloting that is designed specifically to work with students who have IEPs. And so they've
Ooh.
changed the words a little bit. And so you can, I don't know if you could see, probably not because the screen could be really small, but like the first one is I can name my learning differences, disability, medical or mental health diagnosis. It's important for our students to understand what it is. Like we talked to you about your autism
Yes.
and what your autism looks like for you, because it's
Yeah.
going to look different
Yep.
than other people's autism.
Yep.
And so
One of the reasons why I don't like that whole puzzle piece thing that Autism Speaks comes out with,
Yeah.
that does not really work.
I know you don't like the puzzle.
No, I don't like the puzzle.
That's
We're
fine.
not puzzle pieces.
True.
We're not that easily lost.
And so and so it asks other things like, you know, I work on questions before I visit the doctor. I know how to get to my doctor's office. I know who my doctor is. And so then what they did was they took this readiness assessment and they brought in some sample goals. And so if a youth needs to learn on, you know, what is it about me? What is my health? How do I talk about my health? How do I talk about me? Then you could put a goal into the IEP that by the end of the cycle, the student will be able to say out loud what their diagnosis is. They will be able to explain it. Maybe if you're working on a doctor's visit, you work with them on coming up with questions. And so it's this newer transition readiness assessment is just a way that breaks it down so that it's more easily understandable for the school teams that are working with IEPs, because this is definitely something that can be worked on in an IEP.
Yep.
Now, they also have readiness assessments for people with intellectual developmental disabilities. They do have them available in Spanish. And this is just another example of a readiness assessment. At the end of the slide deck, which we'll send out to you tomorrow, there will be links to got transition to all these assessments. So you don't need to worry about where they are now. They'll be at the end of the slide, but we will send you a resource sheet and it will include the links to the assessments.
We will
So-
try to remember to send you the resources.
Haven't forgotten in over a year. So we're gonna do it. All right,
Okay.
all right. Let's talk tools.
Yay.
So here is our website, healthtransitionwisconsin.org. There's an awesome Build Your Bridge workbook if you are parents and you would like a more in-depth parent family focused, digging in deeper to the health transition readiness assessment, deeper into these 8 health tools. We do offer a training called Build Your Bridge, which is specifically for family members that are there supporting their child to move into the whole transition thing. So we do have, it's called Build Your Bridge. We'll be offering that a couple times this year. So just keep an eye out for it. But let's talk about these tools, Hunter.
Yes, let's.
This is why you're here. This is why you're
Yes.
not downstairs playing video games.
No, this is why I'm not downstairs watching people play video games.
I still don't understand that.
Because it's fun and I'm easily bored.
Okay, well, I got solutions to that boredom.
Yes, it's called books.
It's called working chores.
Working on that.
Yes, you are, and I'm
Yes.
very happy about
Yes,
that.
just waiting for a phone
So
call.
let's talk about adult providers.
Yes, let's talk about that
So
pediatrician.
there are some people that have a pediatrician and they need to find a new doctor.
Yes, I was one of those
You
people.
were one of them. So how did you find your new adult doctor?
Through you, because my pediatrician did not understand what we were talking about. Even I didn't understand what we were talking about at the time.
Yeah, so the story goes that I went and I asked your pediatrician to spend a couple minutes alone with you so that you
Yep.
could start to understand that this was your doctor and it was your health, and your
Yep.
health should be most important to you.
Said doctor asked why, because again, this was a
Mhm.
pediatrician and they primarily worked with kids. They did not understand adult care.
Yeah.
Well,
and-
I should say they might have understand it. It was just the fact that they mostly worked around kids.
right, exactly. And so I wasn't really happy about that.
No, and then you asked me why, and that was a whole nother can of words.
Right, because I figured out about then that I had done a really poor job of helping you understand that this
Not-
is your
not
health,
poor.
that doctor wasn't my doctor talking about you.
I wouldn't say you did a poor
Yeah,
job.
there were
It just
things I
was
did,
not
but thank you.
good.
Thank
It
you.
just wasn't, as I said, not good, but not poor. It was just mediocre. Let's go with that.
Okay, we'll go mediocre, but I wanted the doctor to start to talk to you.
Yep.
Because when we go into the doctor's office and the doctor would answer a question, even if he addressed you, what did you do?
I turned and asked you.
Yeah, you turned to mom or me to answer questions about you, which was fine when you were littler.
Yep.
But as you got older, we wanted you to understand your healthcare.
Yeah, I think I was about 14, 15 when we did
So
that.
I introduced you to my doctor. Did you like my doctor?
Loved your doctor.
Okay,
Going
so-
to see your doctor this Friday.
Good job for you.
Well,
Speaking of
our
personal
doctor.
identifiable health information, no one needs
Yes.
to know that.
No. Right.
And so what do you like about your doctor?
Everything.
Do you just deal with him?
No, I also deal with the nurses that work with them.
Okay, so do you feel you have sort of a healthcare team?
Yes. And I love them all because all of them are amazing.
And what do they do that makes you love them?
They understand to keep the medical terms to the most basic English.
True. So they try to avoid the jargon.
They try avoiding bombarding me with large words, which you're still
a good
failing
point.
to do
I
sometimes.
know, I use very large words and I talk very quickly.
Well, talking quickly is okay. It's when you use large words at the same time is where my brain gets more fried than an
Words
egg.
like humongous. Humongous is a very large word.
Humongous is a humongously large word. Try saying that 5 times fast
Let's-
on your spare time.
That's right. So you found a new doctor. Other ways that people have
Yes.
found doctors is they've talked to other kids with special healthcare needs and their
Yep.
parents. They've talked to their pediatrician or their family care doctor and
Yep.
saying, okay, I know my kid's turning 18. What are we going to do after that? Who do you know in the system who you would trust to take care of my kid?
Networking is an amazing spider web
Mhm.
of
That whole sense of networking
confusion.
and asking the questions of the doctors and making sure that you're comfortable and that you have it ready for when that transfer takes place.
Yep. And then comes the next one, decision making.
Decision making. So what happens at 18 on decision making?
You have to make it on your own and you can't go to your parents 90% of the time.
Well, you can still
Outside of
go.
advice.
We'll help you. Right, exactly. We'll help you. But at 18, you're legally it.
Yep.
Your decisions.
Unless
land
you
in
have
your
that
lap.
whole guardianship way of thing,
Yes.
which is annoying because there's so much red tape with that.
There is, but for some of our kids, that's the best route.
It's the best
It's
route.
guardianship, but not
Yeah.
for everyone.
Not for everyone. No, never for
And
everyone.
so we like to talk about supported decision making, knowing that we all utilize help
Yep.
when we make decisions.
We all need help.
Yes, we do.
Some more than others.
Thank you for that. I'm pretty sure you were.
Oh no, I was
talking.
talking about
Mhm.
I was talking about me. With that
Oh,
one.
okay. And so we have to help our kids and ourselves understand, like I have to understand, where is it that you might need help in listening, in learning, in figuring things out, in gathering more information. I don't
Yep.
have to make the decisions for you,
Nope.
but I can
Thank
help
goodness
you
for that.
understand what your decision means.
Yep. And one of the decisions is healthcare insurance.
Yes. How are you going to be insured? And
Mhm.
that includes, the doctors that you see.
Yep.
Do you know the difference between an in-network doctor and an out-of-network doctor?
The out-of-network doctor is more expensive.
Very good. That's
My
pretty
sister
much what you
learned
have.
that.
That's
My
right.
sister learned that the hard way and spent about $500.
And so that's an important thing that people have to learn.
Oh, 100%.
What do you know about copays?
I know that it's $15 with insurance
Right. And when do you have to pay that?
on time.
Yes.
I also learned that the hard way.
Yes. that's
Collection agencies scare me more than the IRS.
Pay your bills. You
Pay
had
the
to
dang
learn to
bills.
Pay your bills. And the copay you're usually paying before
Yes.
you actually see the doctor, which is weird for some people to think about. And so,
But it makes sense.
but a lot of times that's one of those skills that we as parents are just doing.
Yep.
We're just like taking care of making these appointments. We're taking care of paying the copays. And-
Appointment making.
And there are things that we can get you involved with
Yep.
when you're 12 and 13, so that now when you're 24, you
Yep.
could do all this yourself.
Yep.
So
Thanks for getting out my age, by the way.
you're welcome. Appointment making.
Yes.
How did you learn to make your own appointments?
That was a longer road than the Ho Chi Minh Trail.
Thank you for that historical reference.
You are welcome.
So how did you do it? Because I don't make your appointments anymore.
Well,
First off, by making you do the appointments at the very beginning.
Yeah, well, as your parent, I would make the appointments for you because I would also be the one, or your mom would be the one to get you to the doctors. And so they need to match
and
our
then it
schedule
was
too.
me driving to the appointments, but still using you guys to make the appointments.
Right, so we
Because I
would
could
make
not
the
do
appointments.
phone calls. Still can barely do phone
There you go,
calls.
so you didn't like phone calls.
No,
But
still
yet-
don't, but
Back in the day, that's how you made appointments.
yep,
Because you called up and said, I need to see Dr. So-and-so.
yep,
When is he available?
yep.
And you had to tell them all sorts of stuff about yourself.
Which I slowly got into.
And so we initially started with you listening to us making the appointments.
Yep.
And then we tried to bring you on with the speakerphone. And
Yep.
that was kind of successful eventually.
Eventually, once I
Eventually.
got out of walking out of the room after my whole thing of getting zip code, date of birth, name.
All that stuff that they kept asking for every single time.
Yep.
Yep. And then what happened?
Then I made my own appointment with a dietitian.
Yeah. And so you went from not wanting to make any appointments and us making all your appointments to we're sitting home and you're getting ready to go out.
Yep.
And I say, where are you going, Hunter?
I'm going to see a dietitian.
And I said, you don't have a dietitian.
I do have a dietitian. Still need to find their paperwork, but I do have a dietitian.
So how did you get a dietitian?
By asking my primary care doctor how to gain weight healthily.
Oh, so you
Still don't know if
decided,
that's a word.
you decided, it works for me, is you decided that you wanted to do something to be healthier.
Yes.
You talk to your doctor.
Yep.
He recommended meeting a dietitian.
Yep.
So then you set up the meeting with the dietitian.
Yep.
You somehow remembered when that appointment was,
Yep.
and you got there.
Yep.
That's a far cry from the person that didn't want to talk to the doctor's office.
They even wanted to pick up the phone to talk to said doctor's office. And then I discovered my chart.
Then my chart changed your world.
My chart came in barging like a wrecking ball.
And thank you, Miley.
You're welcome,
and
I guess.
So why do you use my chart? How do you use my chart?
I use my chart for basically any healthcare needs, including setting up appointments, contacting my doctors, making sure I'm up on my medications, paying my bills.
You use it for pretty much everything with your healthcare.
Yeah, it is a very useful tool. It's like carrying around a Swiss Army knife.
It's the medical equivalent.
Of a Swiss Army knife.
There you go.
Yeah.
All right. And
Which is kind of ironic, seeing how that it's called a Swiss Army knife.
yeah, that's true.
That-
That's a
that-
good point.
Yeah. Emergency contacts. We skipped over that one.
Oh, what do you want to talk about with emergency contacts?
Keep them on you.
Mm-hmm.
You don't know when you're going to need them.
What are some different? Well, yeah, that's the
I
emergency.
learned that the hard way, because remember when my car froze and I didn't have my cell phone with me?
Yeah.
Yeah, that would have been a perfect time to call one of you guys and go, how the heck do I restart my car to make sure that I can go above 5 miles per hour?
Would have been nice. So
Yep.
when you think medical emergencies, what are different ways that you can keep that information so that if you have an emergency, somebody will be able to help you?
Make sure to have 911 on speed dial. Oh, and carry around your health insurance card.
There you go. You can carry around your health insurance card. You can enter in your emergency contacts into your phone.
Still have yet to do that. Thank you for
Okay.
reminding me.
I remind you every time we do one of these things.
Yep.
But you could also write it down and have a piece of paper in your wallet
Yep.
with just your health information. You know, this is the doctor I go to. This is the insurance that I have. And that's
Yep.
where carrying around the insurance card is really important.
Oh, 100%.
You can also take a picture and have your picture of your insurance card somewhere in your phone. Now you have to remember though, when you enter in that emergency contact information, you don't want to put like your social security number or anything like that in
Never
there.
put your social security number in there.
Right. And
And
so
it's the one thing you keep locked up tighter than Fort Knox.
did you know we actually have instructions about how to put emergency contacts into the phone on our website?
Now you tell me this.
Maybe we'll work on that tomorrow. What else do you want to talk about, dude?
Medications. Can we please talk about
I
medications?
would love to talk about medications because there's
Awesome.
a lot of kiddos that are on a lot of different medications.
Yes.
You, thank goodness again, You don't
Not-
have many, but
not many.
you
Well,
are
actually,
on a lot of supplements to
Yes.
try to keep you healthy.
Yes.
So,
For
and
them
I,
to be
and I
precise.
also know that you're not always good. You haven't always been the best at remembering to do things on a regular basis,
Correct.
such as taking your vitamins.
Yes.
So we decided this was really important.
Yes.
What system did you have set up?
First set of systems was a daily pill organizer created by
Mhm.
my mom, which was very nice of her. She also refilled it. So she
Okay.
was the pill fairy.
So you had a pill case, and your pill fairy made sure that there are always pills in your pill case.
Yep. And then I started filling up the pill case, and now I'm just taking one out of the bottle daily.
So you moved from having your mom separate the pills, putting them in each day. When that week was done, you just counted on her refilling it for you.
Yep. And then, as I said, I started refilling it,
Yeah.
and then we got rid of the pill organizer for me, just straight up taking them out of the bottle.
How's that working for you now?
Really well, can't you tell?
I think it is too. I see you take your medicine every
Yeah,
day,
yeah.
your supplements every day.
Yep.
And so again, it was that step by step
By
step,
step.
is
Yep.
breaking it down into ways so that you could do it yourself.
Yep.
And now you do.
Yep.
Now you make your own appointments.
Yep. I take my
Awesome.
own supplements.
Mm-hmm.
Health, summary, and about me are the same exact thing.
No, they're not, but that's okay if you want to do sing-songy. Health summary is very much more about this is what has been going on with my body or with
Yep.
my mind.
Yep.
The important things about my health history
Yep.
and what the next doctor really needs to know.
Which my
To
chart
keep-
helps with that as well.
Exactly, to keep me healthy.
Yep.
Okay. About me is more about what are my preferences? Like,
Mhm.
do you like to be called Hunterino?
No.
Okay.
That is
so
annoying. Please never
probably
use that
never,
again.
Never call you Hunterino again.
No. You
Probably be
you
really-
just did.
Did I? I'm so sorry, Hunterino. So just so if a doctor knew not to call you that name,
Thank you.
you'd probably like them a little bit better and listen to them and be more part of your care.
Yes.
Okay. So things like, what do I like to be called?
Yep.
What is my gender identity?
Oh gosh.
What is my, do I like to be touched or not touched? Should I use, in your case, should I use a lot of big words and talk a lot? Or should I use smaller words, smaller sentences, and talk less?
That one.
That's how you learn better. And so that would be good for the doctor to know
Yep.
that that's how you learn best. And so
Yep.
the about me is this form separate from a medical health summary. That's more about, this is how my preferences, my likes, my dislikes, and how I will partner with you to do the best healthcare that I can.
Yep.
Cool.
Awesome. Everybody still doing well? No glass eyes?
Well, it is getting kind of late.
Right, I know, but no one is glassing over because we're being boring.
Well, I hope not. So what sort of areas do you think healthcare is important in?
Healthcare management, clinics, employment, independent living, high school,
Okay, stop
post-secondary,
reading this slide.
self-advocacy.
You drive me absolutely nuts.
A lot of things that are very useful in life
Yes.
in general.
So pretty much you're going to succeed more if you take control of your own health.
Yes.
You understand your own health,
Yes.
and that is a process, that there are tools, that there are skills that we can build. There's
Mhm.
knowledge that we can gain so
Yep.
that when we transfer care, we're prepared
Yep.
to take charge of our own health.
Oh, 100%, which is a very good thing.
All right. So yeah, a lot of what you've been talking about tonight is self-advocacy.
Which is very useful. I'm glad I'm a
Yeah.
self-advocate. Some not so much.
So what do you think of when you call yourself a self-advocate? What does that mean to you?
Being able to talk about me. Simple as that. Being able to advocate for myself, my own health, my own life, not really relying too much on others to speak for me, even though that is what politicians do. But that's neither here nor there tonight. We're talking about healthcare.
Yes, we are.
So that to me is what self-advocacy means, is talking for yourself.
Good job. I agree. And I think that's really important. And people get to do that. Everybody's not the same.
Yes.
And so, some people are going to be able to do it more than others. And that goes
Yes.
back to supported decision-making.
Yep.
Is I want to help you understand your decisions, but I don't need to make your decisions for you.
Correct.
But there are some people who, safety-wise, you still need to help them make those decisions. You may have to make those decisions for you.
Guardianship.
And that's guardianship. So we also have different trainings on supported decision-making and guardianship.
Yep.
And so we can talk about that further as well in harnessing abilities.
Yes.
If people are interested in that. So
When people are interested in that, don't say if.
okay,
Never say if when it
when,
comes to
okay,
this.
when people are interested. So
There you go.
we work with, if you are interested in learning more about transition in school and integrating into the IEP, you're going to want to get in touch with the Transition Improvement Grant. Make sure you understand the app, the Post-Secondary Transition Plan, PTP, in the app. There are places in the app where you can insert health information and healthcare goals into the PTP. We talked a little bit about self-advocacy. Did you know that I always like this one? Self-advocacy also means that you get to choose when to pick your battles.
Yep. Not if. When.
When. You don't have to do every
Which
fight.
again, you with the whole app page, you said if instead of when again.
Good point.
Always say when it comes to
One
this.
of my favorite self-advocacy resources is out of the Pacer Center out of
Oh,
Minnesota. So
Nice.
pacer.org. They have some
Well, that's
awesome
supposed to be one
stuff.
of the few good things
Aren't
coming out of
advocacy.
Simon, Minnesota.
Yeah, it's definitely not the Vikings.
No, it's
Ugh.
never the Vikings.
Um,
Though I hear the Twin Cities are rather nice.
they're beautiful and they have a wonderful winter carnival.
Oh, they do.
And so we also wanted to sort of give you a picture of when transition is taking place. And so you can start to think about, we mentioned that at age 14, the post-secondary transition plan, if your child has an IEP, then the post-secondary
ADRC.
post-secondary transition plan should take effect. And then, should be contacting the ADRC because they are the gatekeepers to adult services. So if your child is receiving benefits, public benefits as a child, they need to work through the ADRC, Aging Disability Resource Center, to see if they are eligible for benefits as an adult.
Yep. And then there's that lovely, lovely guardianship.
And then you had to sign up for selective service
Yes,
for
I
the
did.
draft.
They still think I'm born in November instead of December for some odd reason.
Yeah, luckily, I think you're getting to age out of that. If your child is on supplemental, if your child is on supplemental security income, you're going to want to, again, our systems are not smoothly transitioning. So we know that it's the same child and the same family before 18 as it is after 18. But there are steps that you need to take to make sure benefits continue, to make sure Social Security continues. It doesn't happen automatically. And so make sure you're contacting the Aging and Disability Resource Center to figure out those steps that you're going to need to take to make sure there's not a gap in that help.
You don't want to make the Grand Canyon a part of your life permanently.
Right, beautiful place to visit.
Very beautiful place to visit.
Wouldn't
Not
wanna
good
live
for
there.
healthcare.
Right, not good. We also have a healthcare transition timeline.
Oh, hey, look, the Yeti's
Um,
back.
Hi, Yeti. Helping at age 12, youth and families can be made aware of the healthcare policy. Planning can start at around age 14. All these skills that we've been talking about, the tools that are on our website can be introduced and you can start learning about them. At age 16, start talking about what could look different in the care. Is the hospital going to change when they turn 18? Are they going to be able to go to the children's hospital anymore? Is it a brand new hospital maybe they've never been in? So maybe you need to tour an adult hospital. Maybe they need to, you need to learn different ways that they have clinics. A lot of times the pediatric clinics and the young adult clinics, they try to get everything done at once and they do your labs at the same time that you're there. And it's all really nice and integrated. And sometimes in the adult system, it's not quite so integrated.
No,
And so you may have to learn that you have
it's a
to,
rat maze.
it sometimes feels like that,
Yeah,
is you may have to make sure that you have your blood drawn a week before you see the doctor instead
Or
of
a
having it
week
done
after.
right there. Or so there's differences in the way the systems
there's
work.
always differences because we're humans. We can't have anything simple.
We're complicated folks, aren't we?
Yeah,
And then hopefully at 18, transfer into the adult model of care. And then the transfer, that whole transfer takes place. And then integration, they're part of the adult care world and are taking care of themselves as much as possible.
yep.
And again, that
Well, as
that
well as they
healthcare,
can.
right, that healthcare timeline is again from your friends.
Yes,
Yeah,
got
transition.
transition. Yeah, got transition.
So we also ask parents, what would they say to other parents?
yeah,
Well, they would recommend that you make a plan. Don't be surprised at 18 when it happens. So make a plan, record everything. Some parents like a notebook, some parents use the computer.
others use videotapes.
Yeah, we already talked about breaking the project into smaller tasks.
Yep.
Don't be surprised if things take a little bit longer than you think they
When?
should. So don't be surprised if you're like, well, that should be a no-brainer. It should happen with, give yourself plenty of time
Always give
Because-
yourself time.
because things happen. They also say to make sure that you're asking a lot of questions for the people involved in your child's life, especially
Always
in your
ask
child's
questions.
healthcare.
Asking
especially about-
questions
okay,
make
so-
sure things happen.
Yeah, who's the specialist going to be when he
Right.
turns 18?
Where are we going to see said specialists?
Exactly. Are they in the same building? Are they in a
Right.
different building? Are they in a
Exactly.
different city?
Right.
And so asking
How are
these
we going
questions
to get
beforehand.
there if they're in a different city or hospital?
Yes, that's one of the things that you are very fortunate
Mhm.
because of the fact that you can drive
Right.
and
Some
you've learned how to use GPS.
right. Some don't have that option because
That's
they're
right.
incapable of driving because of their health concerns, or they need other people to drive them around because of their disability or because they're in a wheelchair.
And so that's what some people in wheelchair can drive.
Some people in wheelchairs can
But-
drive, but sometimes
But if you're not
some
able
just
to,
don't.
then that's another planning.
Right,
You have to plan how you're going to get there.
Exactly.
Ugh, it
exactly.
gets complicated really, really fast.
Yeah,
All right.
because again, humanity doesn't have anything simple.
So most of all, be kind and gentle with yourself.
And take your time. Always take your time.
All right. So hopefully after tonight is you can have your student or yourself or your child. There are parent versions
Coworkers.
of, don't know about your coworkers.
No,
But
they're
there are-
teachers.
Oh, okay. Yes.
Yeah.
Complete a readiness assessment just to gauge where you're at. What you may be able to learn from is there are ones for parents as well as the youth. Start talking about health. Start talking about understanding how does your youth understand about their healthcare to the extent that they're able to. Visit our website, download the workbook,
Yeah.
ask the IEP team, next IEP team meeting, if your kid is 14 or over, hey, can we insert a healthcare goal? Can we insert a healthcare goal into the IEP?
Mhm.
Start having that conversation with your primary care doctor and your specialists.
Yep, try your best to find your local ADRC or your county's equivalent or state's equivalent.
Mhm.
Because who knows, somebody all the way down in Idaho could be watching this recording for all we know.
Yeah, as long as they're not from Iowa.
I almost accidentally said Arizona.
Okay.
I almost
But they
accidentally
could-
mixed Iowa and Arizona into a single state.
But anyway, if they're not in Wisconsin, you're right.
Right.
They have to find the equivalent
Yes,
of
exactly.
the ADRC.
Because again, we don't know who's going to get this recording.
Yeah, this train record recording.
It's not really a train
No,
wreck.
okay.
It's more of a train drifting on two separate tracks.
Which trains are not made to do.
No, they are not made to do.
But most importantly, take a deep breath, stay a step ahead.
Take
Look
your
at,
time.
yes, you always love to say take
I
your time.
always don't I have a video on that somewhere on YouTube?
Very possibly.
I
But
think I
take
did that in March in 2020.
take your time. Is don't stress out about it all.
Yep.
plan ahead.
Stress is a negative outcome. You don't want a stressful negative outcome.
No. And so we will also include a lot of the
Oh,
different
yeah, that's
resources
neat.
that we've talked about.
We talked to some parent kids recently.
mhm. And so we'll put those websites out for you. And if you have any other questions, you can, of course, feel free to call me. I can also get you in touch with Hunter. If you would like to offer him a job in the Madison area, that would be fantastic. So that's what we're working on now, right?
Yep.
We're working on employment goals.
Yep.
Excellent. All right. Well, thank you very much for being here tonight. We are going to stop sharing and open it up for any questions that you might have, either through the chat or feel free to unmute, and we'll be more than happy to take your questions.
Yep. Really quick, Dan, you might want to enlarge the this photo by unknown author is licensed under that to make sure that those watching the recording aren't part of a copyright team.
Oh, no, that's what I have to put for the picture.
I know.
It doesn't, there's no font size that it needs to be. It's okay. I checked.
Okay.
I checked.
Okay.
Thank you for worrying about that. So
no problem, because lawyers are vicious.
Some are not all.
Disney.
Any questions that anybody might have in this rambling talk that we had tonight? We were rambling more than usual tonight, folks.
This is me on Black Rifle Coffee.
So not sure exactly why, but
I'm sorry.
So, all right. If there are, I am not seeing anything in the chat. What we will do is we will get this recording done. I wish there was something that I could do to edit it a bit, but hey, you're going to just get the whole recording. We're going to get it posted out there. We'll put together a resource sheet of the stuff that we have talked about, so you'll have those links directly with you. We'll get that out to you. If you have any further questions, please feel free to contact us.
Yeah.
Really appreciate you being here tonight. And just, again, remember, healthcare transitions too, and take steps to make it happen.
Yep. Always take your time. Stay a step ahead. If you need to take a step back and breathe, do so. It's why we have vacations.
Yes. But I love that advice. So take your time, is do it in your time.
Yep.
There are some, 18 is a pretty hard deadline.
18 is a majorly hard
you can
deadline.
prepare for that.
Yep.
All right. Well, thanks, Hunter. I appreciate
no
you taking
problem.
your time out to be with us tonight.
I love taking my time to do this. This is fun for me.
All right. We are going to stop the recording and then we'll sign off shortly after that. So thank you all for being here. Oh, we'll also send out an evaluation because I forgot to link it. So I'll send that to you.